Great. Thank you. Good afternoon, everyone. Thank you for joining me and Alex for our uh, weekly, or actually, this is bi monthly, um, question and answer session. With me, I'm Dr. Shah, board certified pulmonologist in the greater Baltimore area. That's where our office is. However, we have patients all over the country, which I'm very appreciative of and happy about. Um, so I'm here to answer your questions and your concerns, and let me know what kind of questions you have.
There's some questions right there. There's two sheets of questions, if you want to relate any of those.
So one of the questions is, how can I build my lungs? Um, and the answer really is simple. It's to breathe. And that sounds kind of quirky, but really, we're going to teach you how to breathe and walk, how to breathe and go upstairs. You'll be surprised that a lot of people really um, take breathing for granted. So we're actually going to um, show you and teach you many techniques on just how to breathe. And just by breathing, you're going to increase the effect on your lungs as far as opening them up, as far as the muscles, your intercostal muscles, your neck muscles, your diaphragm. All these are part of the breathing apparatus. So that's how we're going to build up your lungs. Not only that, but the rest of the body, with some of the exercises that we do, also affect how you breathe. So a better toned, body, a better, you know, um, improves the breathing as well. So it's not just the lungs. The pulmonary rehab affects your whole body, your whole mindset. So it is really a very comprehensive program. It's not you know, just the lungs. It's really the whole body, and that's what we're really trying to help with. And it's a lifestyle change. So it's the whole body, it's lifestyle, it's a whole thought process. So it's just so much more than just one organ system. So an inhaler is good. It can help your lungs, but an inhaler is not going to help with your mental issues such as anxiety or depression. It's not going to help with your confidence so much. It's not going to improve your leg muscles. It's not going to really improve your diaphragm or your intercostal muscles. It's not going to help your heart. But pulmonary rehab helps all of those things. So that's why I really try to get into this program. We have one of the best programs, if not the best program. We have definitely the best program online, that's for sure. I have severe emphysema and COPD stage 4. Do you think the Zephyr valves will help? The question surely is yes. The answer is yes. They will help. However, I would say try to go to a center where they are doing these valves somewhat, have experience with them, because the right candidate is really where it's going to be most effective. And the rehab is part and parcel, I believe, of those valves as well. So a good rehab program like ours, along with the valves being a good candidate for those valves, having a place that has experience, all these things kind of work to your benefit. Because of my fluoroquinolone associated disability, I have muscle fatigue. Is there anything I can do to help with this? I know I also have mitochondrial dysfunction for the Cipro damage. Lori, I think we spoke briefly about this when I saw you. So when you get to that mitochondrial level, there's a lot of issues that most places cannot really, I guess, help or understand. So you really need to be in a more of a university setting for that. Um, there's nothing really specific, so I think rehab is really and kind of pushing yourself a little bit is really one of the main things that you can do to help yourself. Um, Another person is asking, is there any chance of getting better? Um, we wouldn't be doing this if there was no chance of getting better. But you have to put in the time. You have to invest in yourself, and you'll get something out of it. Everybody will get something out of this, on many different levels. So yes, the answer is absolutely yes. How to prevent flare-ups is a question. So what causes a flare-up? Typically a virus or a bacteria, some type of infection. The weather changing can cause flare-ups. Some environmental issues can cause flare-ups. So obviously avoiding environmental things, certain pollutants, smokes, cigarette smoke, avoiding those things. Weather-wise, taking precautions. Some people have difficulty when it's very humid, very hot, or very cold. So taking precautions, limiting yourself in those situations from going outside. Some people I always hear, I'm babysitting my grandchildren. They're always bringing things in, so make sure that the grandkids are, washing their hands. You're washing your hands a lot. Kind of, if they are having a cold, maybe keep a little bit distance. Maybe wearing a mask in the house is not a bad idea. So those are ways to kind of try to prevent. Obviously, flu shots. Flu season is upon us, so make sure you get your flu shot as well. Um, Lori says, during the exercises, my muscles get very fatigued. Yes, you're absolutely right. When you're down to that mitochondrial level, you're gonna feel that fatigue. Um, in certain situations, you definitely can try to push through that. So make sure that your doctor's aware, your therapist is aware of the condition, and they're giving you good advice. So another question is pulmonary rehab. What is it? Pulmonary rehab is a combination of a sense of improving your whole well-being mentally and physically, and that's what pulmonary rehab is. So that entails different types of exercises and coping mechanisms. Smoking cessation can be part of that. Diet is part of that. Nutrition is part of that. So it's really a very comprehensive program. And unfortunately, I see throughout the country, patients tell me, I go to this rehab program and, they tell me, here you go, get on the machine and I'll check your oxygen level in 30 minutes, and then I'll see you later. That is not a rehab program. That's not even an exercise program. That's like, you do everything and then I'll kind of hang out here and I'll see you later. We at Home Rehab Network would never do that, and that's just definitely not part of our DNA to even consider doing something like that. We are engaging. We take our time. We are longer than any program, meaning hour and a half versus most programs are about 30 minutes to 40 minutes. And throughout that time, you're going to be engaged. So it's not going to be like, okay, Mrs. Smith, go and do the insertive spirometer. I'll see you in about 3 days, see how you're doing. I mean, that's not rehab, right? That's kind of like, I don't know. I don't want to say what that is, but it's just not good. I am supposed to limit fluid intake. How do I know how much water I should drink during exercise? That's a very good question. So, the answer I don't have because each person is different. How much you are supposed to limit may suggest that you may have some either heart failure, whether it's right heart, left heart, or biventricular failure. Maybe you have kidney issues. I'm not sure. So that definitely is a question for your physician, number one. And if you have a nutritionist, they may be also there to help you. If it's a kidney issue, obviously your nephrologist will be able to answer that question. So I can't answer the question directly, but I can tell you that if it's a heart issue, it's ask your cardiologist. If it's a kidney issue, ask your nephrologist. If it's both, then you can ask both of them and get a good answer. My sister's ribs is broke and she doesn't know how, but had a CT scan that shows she has a nodule behind her rib in the lung. Now would you approach this? Okay, so Peggy, I don't know the situation, but typically ribs would be obviously broken either. Some people, trauma, obviously, number one. Maybe she fell or hit herself. But the other is some people have very violent cough. Sometimes that can cause it. The nodule, depends on the size. So if it's a nodule that's about 1 or 0.8 centimeters or less, typically we're just going to watch that nodule. Now, what that means is you would have a repeat CT scan either in 3 months or 6 months, depending on the size and the characteristic of that nodule. And every 3 to 6 months, you would have another CAT scan. If it's changing size, then they may want to do a biopsy, and there's a few ways to do a biopsy, or they may want to take it out. They may do what's called a PET scan, which kind of is a scan that it's like a CAT scan, except they'll inject a sugar. The sugar goes to areas where it's kind of eating up that sugar, and that tells us if this nodule is metabolically active or not. And that also tells us the characteristics of this nodule and whether we need to do A, B, and C or C, D, and E. So it really depends on the size of the nodule, how fast it's growing, and what it kind of looks like. If it's smooth, does it have calcium in it? Is it kind of jagged? Is it irregular? So this is very, very, there's very specifics on the nodule itself. So that's something to talk to your physician about. How have you ever had someone with COPD come off oxygen after long-term oxygen therapy? Alex is back there shaking his head. Absolutely. We absolutely have that.
Are you kidding? Seriously? Of course we have. Yes. Why? Why do you think we're trying to get everyone in the program? Is for a difference. I mean, if you came in with all this oxygen, you're on long-term oxygen, you had really severe COPD and things like, why would we want to keep you the same? You would hate us. You know what I mean? So, but yes, absolutely. Sorry.
Shirley is asking, where do I go to see if I qualified for the valve in Rhode Island? So, if you go to, if you Google the Zephyr, actually Pulmonologist has a website. In that website, they list all the providers in all the states that they endorse. So you may go to that website and look that up. So that's one way. The other is talk to your pulmonologist. Typically, the regular pulmonologists do not put in the valves. They will refer you to a interventional pulmonologist, and those are the ones that will be doing the valves. So you can talk to your regular pulmonologist, who will then refer you out and then that person will be the one that would do the valves. So those are the two ways that I think. Then what happens is typically they're going to want to see your pulmonary function test, see if you're trapping air. They're going to want to see your CAT scan, see where the air is being trapped. Is it one area? Is it throughout? And then they put it through their own kind of machine, so to speak, that tells them, yes, the valves can be placed here or there, and that you're a candidate. So the basics, I think, is a PFT and a CAT scan is really the basic and most important aspect of that whole process. All right, very good. Good questions. Keep them coming. What else? How do I know what stage I'm in? So, Rhonda, the stage is based on what we call the GOLD guidelines, and basically, when you do breathing tests in your doctor's office, the staging is based on those breathing tests, and typically, by the time you get to a pulmonologist, most people are in moderate stage. So there's 4 stages, and it goes from mild, moderate, severe to very severe. Those are the 4 stages, and they're all based on the breathing tests, some of the numbers on the breathing tests. Does taking low dose 20 milligrams 3 times a day help your breathing with pulmonary hypertension? You're talking about sildenafil, also known as Viagra. So that's a very specific question for pulmonary hypertension. The dose of 20 milligrams 3 times a day is the kind of the typical dose, the normal dose, and if you do have pulmonary hypertension, I highly suggest that you see a pulmonary hypertension specialist, or make sure your cardiologist or pulmonologist is aware of the treatment options out there, because there's many treatment options depending on what category of pulmonary hypertension. It goes by the WHO classification of pulmonary hypertension, and then based on that, there's specific treatments for that specific condition. So make sure that you're seeing a specialist for pulmonary hypertension. What else? Can rehab help COPD stage 3? The answer is pulmonary rehab can help any stage of COPD, and it's not just limited to COPD. So I want to make sure you understand pulmonary rehab shows benefits not only in COPD, but also in various types of COPD. For example, chronic bronchitis or bronchiectasis, chronic obstructive asthma, but also what we call interstitial lung disease, pulmonary fibrosis of multiple different kinds, and pulmonary hypertension. So it's not just limited to. We also have patients with hypersensitivity pneumonitis, COVID. COVID is, we help so many people with COVID through our rehab, and rehab is really the best thing for post-COVID syndrome, or what they call long COVID, because exercise improves memory, exercise improves obviously muscle function, exercise will improve the fatigue that you're feeling. So COVID is one of our greatest benefactors as far as how people feel after our program. We had an MMA fighter who got COVID into our program, could not get back to where he was, and through our program we helped him get back to his MMA. So I mean, there's all kinds of um, stories that we have. So
Yeah, he was a Hall of Famer, actually.
yeah, he's pretty famous.
Yeah, he was a big Hall of Famer on the MMA side. He made it all the way to he even had name recognition as far as because of HIPAA regulations, we can't mention the names, but he was so he made it to the octagon, several times. He was known for being the West Side Strangler, and that's what they called him in there because he was very good at grappling and choking somebody out, and yeah, so that's
He's very good.
yeah, he was very very
We've
good.
had people who have been on ECMO because of their COVID. People intubated, people with trachs, from COVID. We have rehabbed them back. So it's an amazing program. Amazing program. There was a question about eosinophilic asthma before, and I didn't catch that. My husband has eosinophilic asthma. His doctor would like him to get on Dupixent. My husband has done some research and was very skeptical. He is 50, and we are worried about the long-term effects on his immune system. Are there any exercises you can do to help with the lungs? Where are you located, and would this rehab help the eosinophilic asthma? So, unfortunately, a lot of insurances don't cover asthma as for pulmonary rehab. As far as rehab, we can definitely help you with lung exercises. If he does have eosinophilic asthma, if it is moderate to severe or severe, then it's a little bit beyond just exercises. Although exercises will help, the Dupixent is a fairly decent medication. There's about 6 types of injections that are approved now for eosinophilic asthma. So Dupixent is one of them. There's at least 5 others that I know of. So it's not limited to just that. But exercises, yes. Some things that we can do for him, yes. Unfortunately, I'm not sure if asthma is not always covered by insurance for pulmonary rehab.
She also Lisa stated where you located. So this is a virtual program.
Yeah. Our program is virtual. So we're located, outside of Baltimore, but you can be in California. I saw a patient in Alaska the other day. We have patients in Hawaii, Texas, Missouri. All over the East Coast, all over the Midwest. So anywhere really, really anywhere in the world. We've had patients in Australia. We've had patients in England. So I mean, anywhere in the world you can do our therapy. In fact, we have a patient that is on a tugboat, and he does it on a tugboat. We have patients in a snowbirds boat in their mobile home. They'll do it. So our program can be done just about anywhere. What do you think about long-term low-dose steroids? Are they worth the side effects? Sometimes you need something, you need it. So it's not about, it's not just a matter of, well, kind of what do you think? It's more about, how do you feel? Is it helping you? Are the risks versus the benefits, where are we in that? Is it worth the risk or it's not worth the risk? So most pulmonologists, I can tell you, including myself, our goal really is to get people off steroids as soon as we can, or to minimize them as much as we can. So that's kind of across the board. We do use them, obviously. We do try to get people off of them, but sometimes you can't avoid it. What are the hours for pulmonary rehab in California? So we will adjust the hours. So if you are in California, Sue, we will modify. We'll make sure that the therapy is good for wherever you are on the West Coast. Since we're on the East Coast, we have many patients in California, so the timing should not really be a big issue. Okay. We're also in Puerto Rico. We have patients in El Paso, Texas. Shout out to El Paso. So I mean everywhere. So timing is really not the issue. If you want to do it, we're going to make it accessible to you in some way. So thank you for that question. So there's another question, shortness of breath when walking just to the kitchen. I use a ventilator at night to help with CO2. Can CO2 be helped by rehab? Absolutely, absolutely. Improving diaphragmatic muscles, improving intercostal muscles, you're gonna and utilizing your lungs optimally is gonna help get some of that CO2 out. CO2 makes you very sluggish and kind of tired. So that's definitely going to help in your situation. So I just need a referral. Yeah, so let me just go through the process real quick. You can self-refer, and then we will work to get the referral afterwards, or you can get it referral up front from your pulmonary doctor, your general practitioner, your nurse practitioner, your physician assistant. You can get a referral from any of these folks. So from the hospital, you can get one, or you want to come in and you're not seeing your pulmonologist or your doctor for a little while. We will work to get that referral, to get the office notes, to get whatever we need, so that we can get you into the program. Now, referral is one thing. What happens after you get referred, then we'll go through your insurance, make sure that you have the appropriate insurance. Once that's done, you'll see me, and then I'll make sure that you're appropriate for the program as well, and then you'll be assigned to a therapist, a clinician, who will then do a more thorough kind of run through the therapy with each patient, and then you'll be with that therapist, during the therapy sessions as well. So that's kind of how that process works, it's typically 12 weeks. We can go longer. It all depends on, are your goals met? Are you still improving? Are you still showing signs that you have not plateaued? Those are the kind of things that we're looking for on the other end as well. So I was told that the time for pulmonary rehab is 4 p.m. Eastern, Monday, Wednesday, Friday, but you just said it can be adjusted.
Yes, it's something new. We hired other RTs that can accommodate later times.
All right,
so they didn't have that available, but they have that now. Great question.
Yeah, so we're constantly improving and changing and trying to get more therapists, and so timings will continue to change. So we would continue to try to accommodate all our patients as best as we can.
Do we have time for a quick video?
Sure, we can play a video.
Well, before this program, I could not even stand up from a chair without losing my breath, and that was on oxygen. And with HRN, they gave me my life back. They allowed me to use the tools that they provided. Was a lifesaver. It's all I could say. It was a lifesaver. I do my housework, I vacuum. I mean, it's a little trying, but I get it done. I use the breathing technique, and if I have to, I sit down and rest, but more and more I'm just continuing with what I'm doing and getting it done. I haven't really spoken to the pulmonologist. His office is the one that gave me the paperwork to contact HRN. My primary doctor had asked me questions about it because she saw the progress that I made, and I gave her the information also. think I would still be sitting in a chair with oxygen on and not being able to do anything. If I didn't, again, if I didn't have the tools that HRN gave me, of course, I had to take the time and implement those tools. And it wasn't easy at times, and I felt like, why? But I just pushed through, persisted, and I'm where I am today, and I'm very happy, and I can see the light at the end of the tunnel. They're very aware of who's doing what, and I have to tell you, I was a little skeptical when I heard it was on Zoom.
Yeah.
And I'm like, yeah, okay, how is this going to work? But it's great. Not having to go out, not having to go somewhere, yet getting what we needed. It's fabulous. I walk at least an hour every day inside, but I walk an hour every day. And the day that I don't walk, I ride my bicycle for an hour. I mean, I have friends from the class that are in different states, but we, talk or text, or we're in constant communication, and it's nice to know their feelings and express my feelings, and it's been very nice. I've been talking to them on the phone. They say, "Oh my gosh, you sound so good. You sound so good," because before I was in between, words, and so yes, big difference. My doctor said, "Oh, it's going to be at least a good 6 months," and I'm like, "What are you talking about?" She goes, at least before you're going to see any difference. And the 6 months came, and it was improvement, but of course, being impatient, I wanted me back. I'm not there yet, but still working.
What would you say to somebody who is skeptical about joining HRN?
Do it.
Just do it.
Just do it. Yeah, absolutely. Just do it.
All right, Dr. Shaw, you're back to live.
All right. There's a question there about COVID. I never had breathing problems before. COVID in March of 2020. Spent 2 months in the hospital, 2 weeks on a ventilator. When I came out, I was on oxygen, and when I got COVID vaccine, it made my breathing worse, just like flu shot and anesthetic did for cataract surgery. Everything that goes in my body affects my breathing. So typically, the one question I would have is, because you spent a long time in the hospital, you were on a ventilator, you eventually got on oxygen. The question I would have is how much of the lungs, is there scarring in the lungs? What do your pulmonary function tests look like? For the vast majority of patients that survive COVID, there is a lot of hope through exercise and this pulmonary rehab. There is a lot of hope for you. It will take time, so it's not going to be overnight. It will take a lot of time and effort, but you can definitely get a lot of your lung back. Now, having said that, that all depends on how much scar tissue you may have or lung damage you may have as a result of being in the hospital for so long. But like I said, we've had patients, I can tell you from my hospital that were transferred to, Johns Hopkins, University of Maryland, placed on an ECMO machine, which is basically making oxygen for them because they couldn't generate the amount of oxygen. They had a tracheostomy. They were let go on the trach, on oxygen. The trachs come out, and they're I wouldn't say back to normal, but they're definitely back to, a life. They're walking, talking, they're back to their family. So it definitely worth it. CT scan and hypertension, elongated lung, air being trapped. What's done for this? So CT scan said hypertension. So I assume you're saying pulmonary hypertension, maybe. So on a CAT scan, you can see the pulmonary artery and its size, and that can give you a clue as to if you have pulmonary hypertension. It can also show the heart sizes, and that can also give you a clue. Now, air trapping, very commonly now seen on the CAT scan. What you would do next is basically get breathing tests, correlate breathing tests with a CAT scan, and exercise is the best way to really get out air trapping. Now we have the Zephyr valve, which is the most common lung valve out there. So that may be an option for you, but definitely exercise, meaning pulmonary rehab, and lung valves are two big options for that. So the other question is, shortness of breath. How do I handle it, and what causes it? Somebody asked that question. Obviously, many things can cause shortness of breath. It can be a lung issue, it can be a heart issue, it can be a vascular issue, it can be what's called a neuromuscular issue, meaning the nerves that are responsible for moving the muscles are not there. So it can also be a lot of older folks may have some deformity in the spine, and that can cause shortness of breath. So shortness of breath is kind of a very vague term, and encompasses so many different things. So that's one thing. What to do about it is to try to figure out what's causing it, obviously, and try to figure out a plan through your physician, your pulmonologist, or your cardiologist, or other doctors to figure out how to best handle your breathing. So otherwise, I would say definitely pulmonary rehab is definitely worthwhile to check out if you are short of breath. HomeRehabNetwork.com is our website. 410-871-4601 is our phone number. Please give us a call. If it's for you, give us a call. If it's for your loved one, you can have them call. You can call on their behalf as well. Tell your friends, tell your family, tell your doctors, tell your hospitals.
Question.
Yeah.
What if they ask their doctor and the doctor wants them to go to another pulmonary rehab?
Yeah.
Because the doctor doesn't know about our pulmonary rehab, but because I've heard that has happened before.
Okay. So that's a great question. Your doctor says he wants to send you to pulmonary rehab, but he wants you to go to the local rehab. That's fine. Pulmonary rehab, if he wants to go to the local one, the only thing I would say is, and I'm not trying to toot my own horn, our program is just very good. It's like superior. So if yours has a great review, and a solid track record, yeah, go to your pulmonary rehab. I definitely wouldn't wait weeks or months to get into your program. You can get right into our program. Our outcomes are phenomenal. We take major insurances, so it's minimal out of pocket if anything. So don't wait to get your life back, right? So that's really what it is. So if your local program is good, there's no wait time, you want to drive there, fine. I have no problem. If you want to do it at home, you want to save on gas, wear and tear on your car, wear and tear on you, not asking for rides, so many logistical issues. How good is that program? Compared to ours, all these questions come. What outcomes are they going to give you versus what outcomes we can give you? All these questions come into play. I can definitely vouch for ours. So I have stage 3 COPD and rheumatoid arthritis, anxiety and depression. It appears that every day something new comes up. Lately, I break out in a sweat and have to turn on a fan. Is this normal? That is it normal? So yes and no, in the sense that COPD per se is not going to cause you to break out in a sweat, and rheumatoid arthritis typically does not do that either. Could it be one of the medications for rheumatoid? Yes, possible, but typically that sounds like more anxiety, that you're breaking out in a sweat and you have to turn on the fan. So in chronic disease, anxiety and depression play a huge role. So in that sense, it's kind of normal. Um, and you have stage three, so kind of in the norm, but through rehab, we have coping mechanisms. We give you, one of the things is sometimes people go to the hospital after, during or after they've taken our program. We have a few people, let's say they go to the hospital. It's a totally different way of thinking that they have compared to they've never been through our program. When they're going to the hospital, they're still active. They're still trying to perform. They're still trying to do, what they've learned. They're still telling the therapist at the hospital, I need A, B, and C, and this is what I need right now, And the therapists are like, whoa, where did you come from? So that's empowering. That's called confidence. That's what we're building in this program. So that's on the one end. It's like, you're gaining knowledge, you're gaining confidence, and you take that anywhere. It's just amazing. My doctor wanted me to go to a local rehab, but was in August. Still haven't heard from them. So why wait? I mean, why wait? I just don't know. There's no reason to wait. So we're not trying to take away from any local programs. Okay, I really want to stress that. But why wait? I mean, if you have 10 machines and you have 100 people waiting for 10 machines, um, time is disease. I mean, time is a big factor here. So why wait to get in to that program? We have some of the top universities that refer patients to us. So this is a bona fide program. Why would you wait when you know that we're here? So I would definitely not wait. I have been to 2 different in-person pulmonary rehab programs. Neither of them helped much. HRN is the best. Karen, thank you. That's exactly what we're talking about. I mean, somebody says it's a pulmonary rehab doesn't mean that it is a pulmonary rehab. Or what's the quality of it? What are the reviews? What are people saying? Can you get in there? Do you have a ride? I mean, the studies say if you're 10 miles or more outside of a pulmonary rehab program, your compliance is not going to be good, meaning you're not going to go there. If you're not going to go there, it's not going to help you. And if somebody there is going to say, here you go, here's the machine, I'll see you in a half hour, 40 minutes, that's not a program. That's like a to-do list, right? I mean, that's not what we do. So they're not going to teach you. They're not going to help you. Whatever you get out of the exercise, you get out of it. Outside of that, they're not going to empower you. They're not going to give you that confidence. So really make sure, that it is a legitimate rehab program. A lot of these places are kind of like, yeah, we do, we make fried chicken and we make burgers and we make this and we make that and we make that, right? But we don't do one thing really well. So here we're just doing, cardiopulmonary rehab, and we do it well. So we're not even going to start selling you T-shirts or candy bars. We're just going to do the rehab. So please give us a call, 410-871-4601, and find out if you're eligible. Find out if your insurance is covering the program. Give us a call. Ask away any questions. We're here for you. Our goal is really to help people. That's really our goal. And we want to do it our job the best that we can. So another question was pulmonary fibrosis. Is that helped by pulmonary rehab? And the answer is absolutely yes. So recent study came out showing a great benefit of pulmonary rehab with pulmonary fibrosis, especially what's called idiopathic pulmonary fibrosis. We work with a center that specifically sees interstitial lung disease and pulmonary fibrosis, and specifically idiopathic pulmonary fibrosis. So we have worked with many patients. The other thing is we have an advanced disease pulmonary rehab, and that is a very special entity. So patients who are on a transplant list, patients who are very severe, patients that have multiple comorbidities, we put them in this advanced pulmonary rehab program, and you know, uh, and it's working, and this is done remotely. So and we've had, thank God, no adverse events as a result. We're monitoring these patients. We're making sure that they're getting the proper treatments, making sure that they're not having any issues during the program. So we're talking really, really sick patients that we are seeing and improving their livelihoods, through our program. So it's not just COPD. We're seeing people with heart failure, COPD, pulmonary fibrosis, COPD, pulmonary hypertension. These combinations of very, very, very difficult disease processes, chronic disease processes. So it's really a testament to what we're doing, and helping these people out. And there's a lot of people that need help out there. And again, tell your friends, tell your families, tell your doctors, tell your hospitals. Don't wait for it. Please do not wait for it. It's the studies show that very few percent of patients are being referred to a rehab program, partly because you have to drive there. A lot of people on oxygen, they can't always drive. They rely on other people, partly because they may be too sick to drive, partly because driving somewhere 3 times a week, that's a big commitment. So we've taken all that out. So, from your home, if you've never been on a computer or your phone or laptop or a device, we will help you get on. We will help you with that. So don't be afraid. All right, very good. So 5 more minutes, please. Any questions, let me know. What if you can't commit to 3 days a week? We do have a 2-day-a-week program. 2 days is really the minimal. There is a 1-day-a-week maintenance class as well. We also have mynewlungs.com. So we can do some variations, combinations as well. So give us a call, and we'll see what's the best fit for you. But you can also put some time and effort on your own. Once you start learning the techniques and things that we're teaching, you can start doing them on your own. But there's multiple ways that we can approach the time commitment and the 3 days. So don't hesitate there either. All right, a few more minutes, then we'll wrap it up. Thank you. There's great questions from everyone. Really appreciate it. There's a question. I'm tired of taking prednisone. What can I do to prevent this? Again, as I mentioned before, as a pulmonologist myself and others, I know that we really do try to get people off prednisone. You have to do it very slowly in some cases, especially if you've been on it for a while, because it does affect your adrenal gland. If you get off of it too quickly. So talk to your doctor. Try to get off of it. You can try to increase the amount of inhaled steroid as a kind of a backup. There are some alternatives depending on the disease process for steroids. So talk to your doctor. There's many options that you may have for trying to get off steroids. All right, very good. So I will see everyone in a couple weeks. Stay tuned for Alex's class twice a week, Tuesdays and Thursdays, and mine on Thursdays in about 2 weeks, every 2 weeks. So thank you.